Hello all, hope you're doing well today. Today we are talking about clients with cardiovascular conditions primarily. This is chapter 20, part 1. Here we go. Our objectives in chapter 20 are to understand the pathophysiology and risk factors for hypertension, myocardial infarction, cerebral vascular accident, peripheral vascular disease, asthma, COPD, and exercise-induced bronchoconstriction. You should also understand the stages of the various diseases and how exercise can be used to enhance the client's quality of life, and know when it is appropriate to refer a client to a medical professional. Cardiovascular and respiratory diseases are two separate categories of medical conditions that affect the cardiovascular system and the respiratory system, respectively. While they are distinct, there can be some overlap between the two, as they both involve organs and functions closely related to each other. Cardiovascular diseases, or CVD, refer to a group of conditions that affect the heart and blood vessels. It's important to note that cardiovascular and respiratory diseases share common risk factors such as smoking, obesity, lack of physical activity, and certain genetic predispositions. Additionally, some conditions like heart failure can lead to respiratory symptoms and vice versa. Proper diagnosis, treatment, and management of these diseases often involves a multidisciplinary approach, including medical interventions, lifestyle modifications, and sometimes surgical interventions. Regular checkups, healthy habits, and early intervention are key to maintaining cardiovascular and respiratory health. Hypertension, also known as high blood pressure, is a chronic medical condition characterized by persistently elevated blood pressure levels. Blood pressure is the force exerted by blood against the walls of the arteries as the heart pumps it through the body. There are two main types of hypertension. Primary or idiopathic hypertension is the most common type, accounting for around 90 to 95% of cases. The exact cause is often unknown. Primary hypertension tends to develop gradually over time. Secondary hypertension is caused by an underlying medical condition or medication. Secondary hypertension can result from kidney disorders, hormonal or abnormalities, certain medications, obstructive sleep apnea, or other underlying health issues. Treating the underlying cause of secondary hypertension can often resolve the high blood pressure. Hypertension is often referred to as a silent killer because it usually does not cause noticeable symptoms until it reaches a severe stage. However, prolonged high blood pressure can lead to serious health complications, including an increased risk of heart disease, stroke, kidney damage, and other vascular problems. Typically, blood pressure is measured using two numbers, the systolic pressure over diastolic pressure. The systolic pressure represents the pressure in the arteries when the heart contracts, while the diastolic pressure represents the pressure when the heart is at rest between beats. Blood pressure is measured in millimeters of mercury. Considering exercise guidelines for individuals with hypertension, it's important to prioritize their safety and overall cardiovascular health. Here are some general guidelines. Aerobic exercise, also known as cardiovascular exercises, are especially beneficial for managing hypertension. Engaging in activities that increase their heart rate and breathing, such as walking, cycling, swimming, or cardio machines. Aim for at least 150 minutes of moderate intensity aerobic exercise per week. They can progress up to 75 minutes of vigorous intensity aerobic exercise after a period of time, as long as it's spread across most days of the week. Before starting any exercise session, include a warm-up period of 5 to 10 minutes of light aerobic activity to gradually increase their heart rate and prepare their muscles. Similarly, you want to make sure they're cooling down to gradually lower their heart rate and stretch their muscles. Pay attention to the intensity of the exercise. Aim for that moderate intensity aerobic activity. where they feel slightly breathless but can still carry on a conversation comfortably. And use the scale of perceived exertion. Aim for an RPE, or rating of perceived exertion, of around 12 to 16 on the scale of 6 to 20. Make sure you're monitoring their blood pressure responses before, during, and after exercise. That provides useful information about how their body's responding to physical activity. And at that point, you can start to decide if you can increase the activity to more of a vigorous. Discuss with their healthcare professional about the appropriate guidelines for that. Incorporate strength training exercise of at least 2 days per week. Strength training can help improve overall muscle strength, provide better metabolism, and support cardiovascular health. Start with light weights and focus on a variety of exercises targeting major muscle groups. 2 or 3 days per week, 2 to 4 sets of 8 to 12 reps of each of the major muscle groups. And make sure that they're not holding tightly to the bar, the dumbbell, that type of thing. You want for them to have a good grip, but not excessively gripping. That can increase their blood pressure as well. Moderate intensity should be at about 60 to 70% of the 1 RM. Older adults and novice exercisers should probably begin a little bit lower at about 40 to 50% of the 1 RM. And make sure that they are breathing properly during exercise. You want to make sure they are not holding their breath. Again, that will increase their blood pressure. Drink water before, during, and after exercise to maintain proper hydration. Dehydration can affect blood pressure regulation and overall cardiovascular health. And make sure that they're paying attention to any warning signs or symptoms during exercise, such as chest pain, severe shortness of breath, dizziness, or palpitations. And if they experience any discomfort, stop exercise and seek medical attention. Gradually increase the duration, intensity, and frequency of their exercise sessions over time, starting with shorter and less intense workouts and gradually progressing to longer and more challenging activities. This will help their body adapt and reduce the risk of overexertion. Remember, these are pretty general guidelines in nature, and individual recommendations may vary depending on their overall health, fitness level, and any other medical conditions that they may have. When setting goals for individuals with hypertension, the primary objective is to promote cardiovascular health, managing blood pressure, and improving overall fitness. Here are some other goals to consider. The primary goal to help lower and manage blood pressure levels. Regular aerobic exercise has been shown to have positive effects on blood pressure. Aim to achieve blood pressure readings within a normal range or reduce hypertension stage if applicable, under the guidance of a healthcare professional. You want to improve cardiovascular fitness. It's important for individuals with hypertension. Set goals to gradually increase their aerobic capacity over time. This can be measured by improvements in their endurance, ability to perform activities without becoming excessively breathless, and lowering the resting heart rate. Establish a consistent exercise routine that incorporates aerobic exercise, strength training, and flexibility. Again, aim for at least 150 minutes of the moderate intensity, or 75 once they've built up to that, and their blood pressure is controlled, along with strength training exercises on at least 2 days per week. If weight loss or weight management is a goal, include exercises that help burn calories and promote overall fat loss. Combining their aerobic exercise with strength training can be effective in achieving and maintaining a healthy weight. Regular exercise can help reduce stress levels, which is beneficial for managing hypertension. Set goals to incorporate exercise that promote relaxation, such as yoga, tai chi, or meditation. Along with blood pressure management, aim for improvements in other health markers, such as cholesterol levels, blood sugar control, and body composition. Exercise can have positive effects on these parameters and contribute to overall health improvement. Set a goal to establish a consistent exercise routine and make sure that your clients are adhering to it in the long term. Consistency is the key in reaping the benefits of exercise for hypertension management. Find activities that they enjoy and they're more likely to stick with it. Set goals to gradually increase the duration, intensity, and frequency of the workouts over time. That will help their bodies adapt and ensure steady progress without risking overexertion or injury. And keep a record of their exercise sessions and gradually challenge them to achieve higher levels of fitness. Again, it's important to consult with a healthcare provider to determine appropriate exercise goals based on their individual health condition, fitness level, and other considerations. They can provide personalized guidance and help you in setting realistic and achieving exercise goals for managing hypertension with your client effectively. And that is all that I have for you today. We will be going into more of the respiratory conditions in our next session. That's part 2. I look forward to seeing you then. Have a great day.